automatic response, you go running up. In fact, this is a quote, if you know Gene Rowe from Band of Brothers, they said this about him. He was there when he was needed, and how he got there, you often wonder. And that was our medic. Now on the beaches of Normandy, we really couldn't set up aid stations. We thought the casualty would be a lot lower than it was. So you're doing emergency, trying to get the bleeding to stop. You could either pull them back. Sometimes Higgins boats and boats that were carrying tanks and trucks, they did impromptu surgery on there. But the most part, they try to drag him up to the bluffs and decide what's going to go on, if they're a casualty or not, whether they could be saved. Now, how was the medic chosen? I talked to several original World War II guys in the past couple years, and a lot of times they were volunteers. The sergeant said, go ahead, you're going to be a medic. Sometimes if you had high achievement scores in science and math, you were chosen. If you had like a cool demeanor, that was very important. And this is what I found interesting. If you worked on a farm and butchered, you were used to seeing a lot of blood, bone, and guts. So that was a good pick. Now, once they were picked, how were they trained? Well, we do have, every soldier is issued a basic field manual first aid for soldiers. Now, whether they read it or not, I don't know. A lot of times they were taken under wings by experienced medics and they learned on the field. That's why they wanted someone who was not high strung. I'm surprised I'm a medic. I want to show you, before we get our medic out, what a basic evacuation route is of a battalion. A battalion usually has, 500 to 900 men. Assigned to that, we're about 30 medics. So you can kind of do the math. But first, we have the wounded soldier out in combat. Medics do immediate care. Stop the bleeding, control the pain, get them the heck out of there. They go back to a battalion aid station, which you're going to see here. We stabilize. If we need surgery, go to surgery. And then, depending, we'll have a clearing company. If they need extensive treatment, they go off to the hospital. If not, they rest there and they get back on the front lines. Now, Andy's going to be he's our combat medic. Andy, would you come out? Of course, you know the Red Cross Brassard, how we identify the medic. The 29th actually did not use your typical medic insignia on the helmets, like we have Scott over there doing. Why? Because sometimes they were targets, especially in the Japanese theater. Other times it was a company preference. But this is what they look for. Now, as we're going along here, the medic has a basic, what we call yoke. And on the yoke, we have 2 pouches. And in the back, we have usually he always carries 2 canteens. One, if the wound is bleeding profusely, you pour the water on to see what happened. The other's for drinking, of course. On the back, he's carrying a splint. We are going to have a major leg wound today. So we splint. Turning around, usually in the package, in the yoke, the satchels, the most important things are bandages to cover. We have small and large field dressings. Iodine, a lot of times iodine for disinfectant. We also use sulfa. And of course, the painkiller, the morphine. The morphine. And that's a girl's number. The morphine. There were other things in there, certain pills for analgesics, quinine, all kinds of different things that you would find in a regular pharmacy that you would carry. But those are the 3 most important things. All right. Am I missing anything for yokes?
Nope, you're good.
Okay.
Actually, no, you're not. The medic will also have his own first aid pouch here. I carry a compass pouch here because sometimes you got to find your way out, sometimes you got to find your way back, sometimes you're the only one. Yeah. The medic brings somebody back and go out and find somebody so-and-so somewhere else. Good. Then also, that you'll see that the soldier's lap will be going out and they'll have like the shovel, so there's a tool hanging on their backpack. I'm carrying my backpack today. medics were issued the hatchet, and the reason is that the hatchet is used to cut small trees down to use to provide litters in the field.
Very good.
Thank you.
Okay, so there's a hit. There's a scream. Okay, there it is, the medic. Medic goes out. You want to walk your way down. The wound is in the leg. You're going to pull. Usually, I forgot the scissors, another most important thing. You're not going to take time to roll that up. You're going to take the scissors and cut right through to see the wound. But we're not going to do that to his pants today. He's going to roll up. Got a half a tank in his leg. Now, just so you know, the first sergeant usually never leaves a medic on a field, all right? So sometimes we'll get the litter bearers. It's impossible for litter bearers to get out. A lot of times the aid station could be 1 to 5, maybe even 10 miles behind the front line. So thankfully, we'll have the Jeep to get him back. Other times you had to improvise. You had to take a field jacket. You had to roll them. You could take 2 M1 rifles, roll it on a jacket, and carry him back. At least carry him to safety where you can do more work on them. Now, what you're seeing here, he's putting the Carlisle bandage on. It is bloody. The blood is so bad, he realizes he's going to need a tourniquet. So he pulls a tourniquet, and he's putting the tourniquet on. Before they went into battle, medics were considered pill pushers when they're back. You know, I've got a tummy ache, I'm throwing up, I got a bad cough, and they would treat it. VD was probably one of the biggest issues. And unfortunately, penicillin didn't come until later in the war. So that was a big thing. All right. But when they yelled medic, they were respected. The pain is unbearable. He's taking out a syringe of morphine, usually a gram. Punches right in his thigh. It'll go right in, morphine goes in. Now, with the morphine, if he's on the field, usually 2 ways to identify he had morphine. The broken syringe, you can put on his pocket of it, or his jacket to identify he had morphine. If there's a lot of blood, if there's a lot of casualties, sometimes we'll just dip the finger and put an M on their forehead to indicate he had morphine. Because if the medic doesn't go back and tell the surgeon he had morphine, if it's not identified, he gives him more, he's going to go, his heart's going to suppress. All right.
So the morphine takes a little while to set in, so he'll start feeling it burning through his veins, and then the pain will fall away, and now he's not feeling anything.
Okay. Well, he obviously has a major break in his leg. He'll call for a litter team. Litter. A litter is a stretcher. We call them litters. We're going to put it. We're going to assist him putting the splint on and getting him into the litter.
Hey, Stitch, the splint. Tell them about the splint.
The splint. Okay. The splint is usually made of just a horizontal piece of plywood that they would carry, and I showed them in the back. Sometimes in the field, if they didn't have that, they had to improvise. They would take 2 scabbards off their M1 and put scabbards there and wrap it around. Sometimes they just found sticks. If they're in the woods, you had to improvise. When you're under fire, if you're running around, you had to do what you do. And you only had so much on you. You could carry only so much. So he's putting a splint on. He gave him morphine. He has a tourniquet. Again, you want to stabilize and then get him the heck out of there. And that's what we're doing. It's great if we have a Jeep to transport back. We're gonna play that scenario. Jeep comes in. They call for the litter team. We're gonna pick him up. Here he goes. I've seen litters put in the back. They would rig a litter in the front sometimes too. I've even seen them like bunk beds, which I can't imagine them driving through terrain. Now, obviously, he looks like he's going into shock. He's becoming pale. His heart rate is beating. We're going to put plasma in. plasma is just to prevent the shock. It's a liquid protein, and for Doc, correct me, plasma, liquid protein, and like the white and blood cells and the platelets are kind of diffused out of it. All right, it's just to give him hydration so he doesn't go into shock. Now, when he comes back, we could get him a blood transfusion. We'll have him hanging in the OR. All right, he's in. A lot of times, it's in. The Jeep driver gets in. They're driving back. One of the litter bearers will hold the plasma in the air until he gets it. But I can't imagine going through dirt roads, brush, everything is probably bumping like crazy. And a lot of the other little bear will kind of keep it down, holding them, talking to him, giving him some type of moral support. All right, he's back to the battalion aid station. Triage. They're going to pick the litter up. The medic will hold the plasma bottle, and they're going to get him back to the triage station. Back casualty come in. We have a leg wound. We put a tourniquet on him. A lot of blood loss.
Excuse me, man. Go ahead.
He's stabilized. Let's take the IV out of him. Okay? We'll take the IV out of him. Oh, okay, no, we have the plasma going here. My bad. Yeah. And
Hey, you okay?
Doc Benner will continue from here.
Can you hear me? Yeah?
I'm trying to get the move for you.
You're fine. I want to make sure the tourniquet's even tighter so it's not the bleeding. Looks like we got a fractured femur. So we're going to split the femur and we're going to get him to surgery as soon as we can.
Now, while this is going on, he's setting up the fracture of the femur. When there is a wound out in the field, we have what we call identification tags that we usually put on the wounded, because a lot of times medics can't come back. They're still in the field. Litter bearers, that's not the responsibility. You have to get them back. So identification tag, the medic will put the name on, the age, person to be notified would be the doctor, where he was tagged, what kind of the diagnosis, what happened. He can even put tourniquet, which is on here, morphine, which is given. So if they have time to do the tag, they tag them. If the battle has moved on, they can tag them. If not, they don't have time. But this is what they would carry. Signed by the medic, placed on him, usually there's string tied on him, and then take him back. While that's going on, they're taking blood pressure, of course, to make sure he doesn't go into shock. And usually a medic knows there's basically 3 types of wound. Penetrating, which is going to be a bolt in, perforating, where it just kind of blows out, and lacerating. So that's the kind of wounds we look for of how to do the treatment. A lot of times, which is interesting, when you have shrapnel, guns blowing. This happened a lot in the Ardennes forest and Battle of the Bulge, where they would split trees and giant splinters would go into it. It was murder. Also, fragments would go in. And sometimes the fragments were called white hot. They would go through, come out, and they would actually cauterize the skin itself, where you wouldn't see the bleeding, but you would internal damage with the cauterization. All right, Dr. Explaining anything here?
Just putting the split on.
He's going to need surgery, Doc. You have to modify.
I can't.
Besides the unsung hero, the medic was also known the man without a gun. We did not carry guns. You may have heard some stories or especially in the Pacific Theater, where the Japanese didn't abide by the Geneva Convention as much as the Germans did. And some medics were known to carry 45s to protect their patients. But for the most part, man without a gun. Our casualty rate was very high. And every infantryman should know basic first aid. And they probably learned on the job, even though they had their first aid book. And can you step out of sight, please? All right. You made this again, Doc, so it's not the top. It's attraction. It's a traction splint. Yep.
Okay, so now once he's stabilized, the wound is stabilized. It doesn't look like it's bleeding at all, but there is a fracture in the femur, so he's going to need to go to surgery and have that external fixator or stabilize that fractured bone. Everything else is okay. I checked his heart and his lungs. He's breathing. We got plasma running, so he's stabilized enough to be transported to the next section.
That was the goal of our triage. We got him stabilized. Coming over to the OR, we actually have an OR doctor.